पैकेट खोलने से पहले इसे अच्छी तरह सैनिटाइज करें। पैकेट से निकालकर खाना किसी साफ बर्तन में रखें। जहां पैकेट रखें उस जगह को भी सैनिटाइज करें। पैकेट को छूने के बाद अपने हाथों को कम से कम 20 सेकंड तक साबुन से जरूर धोएं।
नमस्कार, मैं हूं रवीना टंडन और मेरी आपसे अपील है कि इस वक्त सुरक्षा बहुत जरूरी है। इसीलिए जरूरी है कि आप और आपका परिवार घर पर ही रहें। हम घर पर रहकर किताबें पढ़ सकते हैं, फिल्में देख सकते हैं, घर के बच्चों के साथ खेल खेल सकते हैं और बच्चे भी ऑनलाइन ऐप के जरिए पढ़ाई कर सकते हैं। बड़ों के साथ बैठकर कहानियां सुनिए, बड़ा मजा आएगा। प्लीज चिंतित मत होइए। जो आपके रोज की सुविधाएं हैं जैसे किराने की दुकान और दवाइयों की दुकान, वो लगातार खुली रहेंगी। अपने गवर्नमेंट और एडमिनिस्ट्रेशन की सुनिए। प्लीज बी सेफ, प्लीज स्टे एट होम। यही हमारी आपसे विनती है। जय हिंद।
हम आज फिर ये युद्ध लड़ने आए हैं। हम आज फिर अपना फर्ज निभाने आए हैं। हमारे भी घर वाले चिंता करते हैं, पर आज देश की कोरोना से लड़ाई है और हमारा हौसला ही तो इस जंग का सिपाही है। कोई कुछ भी कह ले या कर ले कुछ भी, हम खुद से पहले अपना देश बचाने आए हैं। इस रणभूमि में शायद सांस हमारी भी टूटेगी, पर तुम्हारे प्राण बचाने को हम खुद को निछावर करने आए हैं। वार सभी हम सह लेंगे, पर हार नहीं हम मानेंगे। इस अंधियारे से हम जीतेंगे, फिर देश को रोशन कर देंगे। हम आज फिर ये युद्ध लड़ने आए हैं। हम आज फिर अपना फर्ज निभाने आए हैं। आइए करें उन्हें नमन जिनके लिए सबसे पहले है वतन। भारत सरकार द्वारा जनहित में जारी।
Hydroxychloroquine, to be strictly used only on doctor's prescription. Taking it without doctor's advice can be harmful and life-threatening.
Hello, you're watching DD News and I'm Preeti presenting this special edition Tracking COVID-19, wherein we get you all the updates and developments related to this pandemic. Even as you all stay indoors following the self-quarantine norms, we get you this special edition each day. We get you international updates, we get you ground reports, inputs from our reporters, words of advice coming in from our doctors, and also lots more to keep you acquainted with the latest happening around you related to COVID-19. So let's get started with the headlines first. Prime Minister Narendra Modi is interacting with chief ministers of the states through video conference to discuss aspects relating to COVID-19 situation. Over 684 tons of essential and medical supplies delivered by Lifeline Udan during lockdown. 383 flights operated under Lifeline Udan. Active coronavirus cases across India increased to 20,835 with 872 fatalities and 6,184 recoveries. Union Health Minister visits AIIMS Trauma Centre in Delhi to assess preparedness on COVID-19. And COVID-19 cases continue to spiral up globally with over 29.68 lakh confirmed cases worldwide. Global death toll crosses 2 lakh mark while death toll in the US crosses 54,000. recording 1,330 deaths in the last 24 hours. Nepal extends nationwide lockdown till May 7th. Let's get you all the updates related to the pandemic in India in our segment Ground Zero. Now, according to the Ministry of Health and Family Welfare's data, 20,835 active cases of coronavirus have been recorded in the country. Further, 6,184 persons have fully recovered from the illness and have been discharged, while 872 people have lost their lives. Also, according to the data, Maharashtra continues to remain the worst hit state, with total number of positive cases rising to 8,068, followed by Gujarat at 3,301, Delhi at 2,918 cases and Rajasthan with 2,185 cases. Prime Minister Narendra Modi is currently interacting with chief ministers via video conference on the way ahead in the fight against novel coronavirus. The meeting comes amidst indications that the discussions could also focus on a graded exit from the ongoing lockdown. Now, this is the fourth video conference of the Prime Minister with the chief ministers after the spread of COVID-19 in the country. The centre and the state governments have been giving gradual relaxation in various fields and sectors to boost economic activities as also to provide relief to people. But some states are willing to extend the lockdown beyond 3rd of May to ensure that coronavirus cases remain under control. The centre has now allowed neighbourhood and standalone shops, including those located in residential complexes in urban areas, to open during the lockdown. But those in the markets continue to remain shut till 3rd of May. In rural areas, all shops except those in shopping malls are allowed to open. And Union Health Minister Dr. Harshvardhan yesterday visited AIIMS Trauma Centre and reviewed the health facilities for COVID patients. He expressed satisfaction over the work done by various units. The minister said that the government efforts have put a check on the number of COVID-19 patients and mortality in the country. He said that the death rate in the world is around 7% and in India it is around 3%. He said that the rate of doubling of cases in India is also better than the rest of the countries.
सारे दुनिया का एवरेज अगर मोर्टेलिटी रेट ग्लोबल एवरेज जो है वो 7% है, तो हमारा आज भी 3.1% बना हुआ है। पिछले 3 दिन का अगर मैं डाटा की बात करूं तो अगर 14 दिन के अंदर हमारा डबलिंग रेट 8.1 था, तो पिछले 7 दिन के अंदर वो डबलिंग रेट हमारा 9.3 हो गया। और अगर पिछले 3 दिन के डबलिंग रेट की मैं बात करूं तो ये 10.5 है। यानी लगातार हमारी जो देश में स्थिति है वो इम्प्रूव होती जा रही है।
The minister said that the government has made a 3-tier arrangement for treatment of patients of COVID-19, COVID Care Centre, COVID Health Centre and the COVID Special Hospital.
2 लाख से ज़्यादा बेड्स और इसी प्रकार से बहुत बड़ी संख्या में आईसीयू के बेड्स, इनका इंतज़ाम सारे देश के अंदर हम लोगों ने किया है। पर्याप्त मात्रा में पीपीई किट्स, N95 मास्क और वेंटिलेटर्स की व्यवस्था की है।
Lifeline Udan flights are being operated by Ministry of Civil Aviation to transport essential medical cargo to remote parts of the country to support India's war against COVID-19. 383 flights have been operated under Lifeline Udan by Air India, Alliance Air, Indian Air Force and private carriers. 223 of these flights have been operated by Air India and Alliance Air. Cargo transported till date is around 684.08 tons. Helicopter services, including Pawan Hans Limited, have been operating in Jammu and Kashmir, Ladakh, Island Territories and the Northeast region, transporting critical medical cargo and patients. Special focus has been given on the Northeast region, Island Territories and the Hill States. In the international sector, a cargo air bridge was established with East Asia for transportation of pharmaceuticals, medical equipment and COVID-19 relief material. And the government is keeping a close watch on fake news or misinformation on government policies and schemes spreading across the country. On the Twitter handle of PIB Fact Check, such myths are countered and clarified. One such myth is that standing in sun or being in an atmosphere with temperature more than 25 degrees will save the person from coronavirus infection. The truth, however, is that variation of temperature does not amount to any change in coronavirus infection, as the cases of the virus infection have been reported from countries with high temperature as well. So, to keep yourself safe, make sure you wash your hands regularly and abstain from touching your nose and mouth. The next myth which is witnessed is spreading is that the vaccine of pneumonia prevents coronavirus infection. The truth is that no, the pneumonia vaccines like pneumococcal vaccine, Haemophilus influenza type B vaccine does not prevent coronavirus infection, as the novel coronavirus is a new virus which requires its own specific vaccine. Researchers are trying to develop its vaccine with the help of the World Health Organization. The last myth we check is regarding the ultraviolet disinfection lamp, whether it kills coronavirus or not. The truth, however, is that ultraviolet radiations are extremely harmful for human bodies. Thus, the ultraviolet disinfection lamps should not be used to sterilize any part of the body. The Delhi government has said that it will implement the new guidelines of the union government regarding opening of mobile, clothes and stationery shops. Shops in areas with corona infection will remain closed and no activity will be allowed in such areas. Apart from this, shops in residential areas will be opened with strict compliance of social distancing norms. And up next, we'll take a look at this report filed by our correspondent Anibrato from Kolkata, where cases of coronavirus infection are increasing rapidly. Let's listen in.
Kolkata, the city of joy, is facing lockdown. We are indeed in the middle of the second phase lockdown, but a major cause of concern is that corona positive cases are on rise here in city Kolkata. It's not only Kolkata, but in the outer districts, Howrah and North 24 Pargana are also accounting to it. It is said that more than 80% of the corona positive cases are from Kolkata and Howrah. The government is taking all precautionary measures needed to tackle this menace. Now, state government also identified several red zones in Kolkata. Now it stands more than 145 red zone in Kolkata. And it's increasing. The government has made it mandatory to close the bazaar by 11:30 a.m. in the morning. And in several bazaars we have found the sanitization tunnel has been set up, through which the people are entering into. It's certainly a vote measure that has been taken. It's indeed a cause of concern that corona positive cases are on rise here in city Kolkata. With cameraman Pradeep Ghosh and Pinak Rai, I am Anibrato Bhattacharya reporting for DD News from Kolkata.
Flight Base, an enterprise incubated at the Bhau Institute's Incubation Center, Government College of Engineering, Pune, Technology Business Incubator, that is TBI, under Department of Science and Technology, is offering a digital platform that can monitor ground-level situations by integrating with drones. Now, the platform allows drones increasingly being used for aerial monitoring, emergency response or urgent delivery of blood samples, medicines, as well as lockdown surveillance. Take a look.
As social distancing is the only way to stay safe during the coronavirus pandemic, drone solution startup Flight Base has come up with an innovative method to ensure minimum exposure to the virus. The Pune and Silicon Valley based startup is now offering free remote drone operation to users involved in public health initiatives working against COVID-19. The platform called Fly Now allows drones increasingly being used for aerial monitoring, emergency response or urgent delivery of blood samples, medicines as well as lockdown surveillance to be operated remotely for managing different aspects of COVID-19.
Flightbase is providing a digital platform to deploy drones for COVID-19 response. Drones are being used for aerial monitoring, emergency response, and delivery of medical supplies and blood samples. We are working with a group of volunteers called Indian Drone Squad who are helping us deploy drones across India for various use cases. They are actively working with police authorities to deploy drones for live situational awareness and get live video feed at a centralized location. This is helping police get the complete picture of an area at their centralized location.
The platform is already being implemented in Gujarat, where Drone Lab, working along with 200 local drone operators, is helping authorities to identify crowded areas and intimating the police control rooms in real time in order to take necessary action. With this platform, unmanned aerial vehicles can be deployed without putting human helpers at risk of contracting the coronavirus. Equipped with payloads such as beacons, loudspeakers, and sirens, drones are serving as a public safety aid, sending live video feeds to COVID-19 control centers, warning people of the need to stay indoors, as well as potentially spraying disinfectants. Amidst a fast maturing startup ecosystem in the country, the entrepreneurs are showing us the way. They are once again proving that this startup industry, the startup ecosystem has developed, and they are now competing with the best of the world. They have also come up with solution to provide the COVID warriors in this time of pandemic. This is Taposh Bhattacharya, DD India, Delhi.
And up next is our segment Good News, wherein we get you reports of the feel-good factor in these times that show that life goes on and hope and positivity still live on in these distressing times. Amidst the coronavirus scare, it has become a challenge for the administration to sort out the problems of people, particularly the migrant laborers and poor who have been locked in Kathua district of Jammu and Kashmir. Some volunteers here approached SSP Kathua with the consent to help the needy people. A helping group in collaboration with Jammu and Kashmir Police under the name of United Kathua Jammu and Kashmir Police has been working round the clock and have started community kitchens at different locations in the district to provide meals twice a day to the needy. At present, there are over 16 such kitchens which have fed nearly 16,635 needy people. Locals are also actively stepping forward to lend their services. And in Gujarat's Navsari, the district panchayat ordered for more than 20,000 masks and 30,000 PPE suits to provide essential commodities to the doctors and nurses fighting coronavirus at the forefront. Now, these masks and PPE suits are being tailored from non-woven material so that the contact from outside surface could be barred. As of now, 200 suits are being made in a single day by around 18 workers who are working day and night. These essentialities will then be transported to various hospitals across the city. And still with Navsari, as the police staff are working round the clock in challenging environment to curb the spread of COVID-19, some support groups took the initiative to serve food to these corona warriors. With support of Navsari Zilla Traffic Education Trust and Diamond Association, wholesome meals are being prepared twice a day and distributed at various locations for the police staff. And also, the police staff are being served with snacks at regular intervals. And in Kerala's Kozhikode district, a woman is taking the initiative to provide masks in order to fulfill the increasing demands. Being a Divyang is no reason to turn her back from doing the deeds and turn back from any social activity. Volunteer Leela now has already distributed over 900 masks in her local area and is currently busy delivering more. And up next is World Wrap, wherein we get you international updates related to COVID-19. COVID-19 cases continue to spiral up globally with over 29.68 lakh confirmed cases worldwide. Global death toll has also crossed the 2 lakh mark. United States remains the worst affected country, recording 1,330 deaths due to COVID-19 in the last 24 hours. The US now has an overall death toll of 54,856 with 9,65,426 confirmed infections. The total number of people recovered in the US stands at 1,06,985. The state of New York, which is the epicenter of outbreak in the US, reported 367 new deaths from the virus yesterday. Now, this is New York's lowest daily total since March 30th. Governor Andrew Cuomo said that construction and manufacturing would be the first businesses to reopen and could restart after May 15th with certain precautions and if cases continue to decline. Georgia, Oklahoma, Alaska and South Carolina have already taken steps to restart their economies following a month of government-ordered lockdowns. In Spain, Igualada municipality in the province of Barcelona becomes the first municipality to have finally been able to taste freedom after 6 weeks of the lockdown. Spain declared state of emergency on March 14th and shut down most public life and economic activity. The ease comes as the first step of the government towards gradual easing of restrictions. The country registered its lowest daily increase in the death toll in more than a month. Total number of deaths currently stand at 23,190, while the overall number of cases has risen to 2,26,629. And Italy registered its lowest day-to-day increase in the deaths of those infected with the novel coronavirus since the country was in its first week of lockdown in mid-March. Recording 260 new deaths yesterday, the daily grim statistic was last lower on March 14th when 175 deaths were registered. Meanwhile, Italian Prime Minister has said that the country will cautiously begin lifting the nationwide lockdown on May 4th, giving an initial respite to businesses paralyzed by week of containment measures. In the proposed restrictions eased, he said that parks will reopen, but schools will not restart their classes until September. Italy has reported, we'll get you that in a while from now, we'll get you more details on the global scenario, but we'll go back to our top story. We are tracking at this hour. We told you that Prime Minister Narendra Modi is currently interacting with the chief ministers via video conference on the way ahead in the fight against novel coronavirus. The meeting comes amid indications that discussions could also focus on a graded exit from the ongoing lockdown. Now, this is the fourth video conference of the Prime Minister with the chief ministers after the spread of COVID-19 in the country. The centre and the state governments have been giving gradual relaxation in various fields and sectors to boost economic activities, as also providing relief to the people. But some states are willing to extend the lockdown beyond 3rd of May to ensure that coronavirus cases remain under control. Sudhakar Das is joining us with more on the phone line. Sudhakar, we've given a broad outline of what all could be taken up in this meeting which is going on between the Prime Minister and the Chief Ministers. Let us know more details.
जी प्रीति, देखिए सुबह 10 बजे ये बैठक शुरू हुई है और बेहद ही महत्वपूर्ण है। हमने देखा कि बैठक शुरू होने से पहले प्रधानमंत्री कार्यालय की तरफ से ट्वीट भी किया गया कि इस बैठक में जो कोरोना महामारी से जुड़े हुए जो तमाम मुद्दे हैं, जो स्थिति है, उसको लेकर आगे की चर्चा होगी और निश्चित तौर पर एक बहुत ही महत्वपूर्ण पड़ाव पर पूरा देश है। हमको पता है कि प्रधानमंत्री का ये चौथा संवाद है मुख्यमंत्रियों के साथ। इससे पहले उन्होंने मार्च में एक संवाद और इससे पहले 2 अप्रैल और 11 अप्रैल को भी मुख्यमंत्रियों के संवाद किया था और वो लगातार सिर्फ वीडियो कॉन्फ्रेंसिंग के जरिए ही नहीं, टेलीफोन और अन्य माध्यमों के जरिए भी वो लगातार बातचीत कर रहे हैं तमाम मुख्यमंत्रियों से, केंद्र शासित प्रदेशों के एडमिनिस्ट्रेटर से, और वो बल्कि चर्चा के माध्यम से विशेषज्ञों की राय के जरिए आगे बढ़ने के और कई अहम कदम उठा रहे हैं। और इसकी वजह से ये संभव हुआ है कि भारत जैसे इतने बड़े देशों में अगर आप दुनिया के अन्य देशों से तुलना करें तो एक तरह से हमने अब तक इससे अपने आप को बचा के रखा हुआ है। जो केसेस है उतनी तेजी से वृद्धि नहीं हुई है जितना असर दुनिया के अन्य देशों में, अमेरिका, यूरोप में देखने को मिला है। लेकिन निश्चित तौर पर अब आगे की क्या रणनीति होनी चाहिए, किस तरह से जो एग्जिट प्लान जिसकी लगातार प्रधानमंत्री एक तरह से चर्चा करते रहे हैं, क्योंकि 2 मुद्दे हैं। एक तो जो हॉटस्पॉट वाले जिले हैं, करीब 125 ऐसे जिले हैं, अगर उनकी बात की जाए तो वहाँ सख्ती से जो लॉकडाउन के जो तमाम नियम हैं उनको कैसे लागू किया जाए, तो साथ ही साथ 600 ऐसे जिले जो हॉटस्पॉट नहीं है वहाँ किस तरह से आर्थिक गतिविधियों को और तेज किया जा सकता है। और हमने देखा कि हाल के दिनों में केंद्र की तरफ से कई अहम कदम उठाए गए, खासतौर से ग्रामीण अर्थव्यवस्था को खोलने की कोशिश की गई और उसमें ये अपील लगातार प्रधानमंत्री की तरफ से, केंद्र की तरफ से, सरकारों की तरफ से की गई कि सोशल डिस्टेंसिंग, हाइजीन के मानकों का पालन किया जाए। प्रधानमंत्री ने खुद नारा दिया है कि 2 गज दूरी है जरूरी, और इस तरह के जो तमाम जो सतर्कता करने वाले उपाय कैसे उसको लागू करते हुए आर्थिक तौर पर एक तरह से फिर से देश को खड़ा किया जाए, सशक्त किया जाए, ये तमाम ऐसे मुद्दे हैं जिन पर प्रधानमंत्री चर्चा कर सकते हैं और वो लगातार उनकी ये कोशिश रही है। हमने देखा कि पिछले 2-2.5 महीनों में केंद्र ने, प्रधानमंत्री नरेंद्र मोदी ने जो अहम और बड़े कदम उठाए हैं और एक तरह से एक कलेक्टिव, सामूहिक तौर पर पूरा देश एक साथ मिलकर कैसे फैसले कर सकता है, कैसे उस पर आगे बढ़ सकता है, कैसे उसको लागू कर सकता है, वो तमाम चीजें हमने देश में देखी और इस वजह से ये संभव हुआ कि भारत जैसे इतने बड़े देश में लॉकडाउन को प्रभावी तरीके से लागू किया जा सका। और साथ ही साथ इसकी वजह से हमने जो अपनी तैयारियां पूरी पिछले 2-2.5 महीनों में की, चाहे 2 लाख से ज्यादा हमने आइसोलेशन बेड्स बनाए हो, आईसीयू या वेंटिलेटर्स की जो हमने व्यवस्थाएं की हो, इसके अलावा जो ट्रेन किया गया है, ट्रेनिंग दी गई है इस महामारी की चुनौती से निपटने के लिए स्वास्थ्य कर्मियों को, हमारे फ्रंटलाइन वॉरियर्स को, या फिर जरूरतमंदों तक मदद।
Right, Sudhakar.
जी।
Yes, Sudhakar, we know that the lockdown, the second lockdown will end on 3rd of May. Now, also we've told our viewers that this is the 4th meeting which the Prime Minister is having with the Chief Ministers. When we started with the lockdown, the circumstances and the situations were different from what we are facing now. Now, when we talk of the challenges earlier, it was important for the government to convey to the people to stay indoors, to practice social distancing, to maintain personal hygiene. And also we saw earlier the focus was on Jaan hai to Jahan hai. It got further modified to Jaan bhi Jahan bhi. So now, what stage, given the stage and given the way the situation is evolving, what are the areas of concern for the government from here on? Put all this together.
देखिए, ये बात बहुत समझना जरूरी है, जिसको केंद्र सरकार, प्रधानमंत्री खुद भी मानते हैं कि देखिए अभी इस महामारी की चुनौती से निपटने के लिए कोई ऐसी कारगर दवाई या जिसके वैक्सीन की जो बात की जा रही है, वो अभी तक दुनिया में कहीं आया नहीं है। तो इसमें एक थोड़ा सा वक्त लग सकता है। ये इसको हमने रोक के रखा है, लेकिन इसका ये मतलब कभी भी नहीं है कि ये और भी प्रसारित नहीं हो सकता, और भी बढ़ नहीं सकता है। तो तैयारियां इस लिहाज से होनी चाहिए कि हर स्थिति में देश उन स्थितियों का मुकाबला कर सके। पहली तो ये बात है, लेकिन दूसरी बात है, इसके साथ साथ ही जो अर्थतंत्र को और धीरे धीरे खोलना भी जरूरी है। तो इन दोनों के बीच कैसे एक तरह से संतुलन बिठाया जा सकता है, सामंजस्य बिठाया जा सकता है। अगर कहीं दिक्कत है, कहीं हॉटस्पॉट है, तो वहाँ सख्ती से काम करने की जरूरत है। तो जहाँ इस तरह की दिक्कत नहीं है, वहाँ तमाम मानकों का पालन करते हुए, 2 गज की दूरी बनाते हुए, हाइजीन का पालन करते हुए कैसे आर्थिक गतिविधियों को और मजबूती प्रदान की जा सकती है। उसमें मुख्यमंत्रियों की क्या राय है, मुख्यमंत्री किस तरह से पूरे सिनेरियो को, पूरी स्थिति को देखते हैं, वो क्या कुछ और चाहते हैं, और प्रधानमंत्री उनकी राय सुनते हुए उनके सलाह के आधार पर आगे की रणनीति बनाना चाहते हैं। और इस लिहाज से ये पूरी बैठक बेहद ही महत्वपूर्ण कही जा सकती है। खासतौर से 3 मई के बाद देश किस तरह से आगे बढ़ेगा, किस तरह से चुनौती का सामना करेगा, उस लिहाज से अगर बात की जाए तो प्रीति।
All right, the way forward is being discussed at the meeting which is presently going on between the Prime Minister and the Chief Ministers of different states. Thank you so much, Sudhakar, for joining us with those updates. And we'll keep you updated with the ongoings of the meeting. At present, that's it in this edition of Tracking COVID-19. Thanks for watching. Namaskar.